In January, the Ministry of Health informed the country of the first confirmed case of the Zika virus in Jamaica. Shortly after, increased cases of influenza, particularly H1N1, was also confirmed. In response, action is being taken on several fronts to protect public health. Influenza or the flu is a viral respiratory illness usually resulting in symptoms such as fever, sore throat, cough, stuffy nose, headache, and body aches and fatigue. While most people generally get over the flu fairly quickly, it is estimated that over 56,000 persons die each year from influenza and pneumonia-associated complications. Here in Jamaica, the Health Ministry has confirmed a number of deaths associated with the influenza A H1N1 virus this year. To curtail those numbers, intervention was expanded and accelerated. As a first step, doctors were mandated to notify the ministry about suspected cases of severe acute respiratory infections, including H1N1, within 24 hours instead of the previous stipulation of 1 week.
And then we also sent out what we call a case report to remind physicians of what we're looking for and who would be a suspect case. So they don't need to be confirmed. If you suspect, we want to know within 24 hours.
The supply of flu vaccine has been beefed up, with frontline healthcare workers encouraged to take the shot. And looking to the next flu season, Health Minister Dr. Christopher Tufton has mandated that more flu vaccines be ordered to cover all healthcare workers as well as members of the population in the high-risk groups for severe complications.
And that would include the elderly, persons, women who are pregnant, children, and those with chronic illnesses like asthma, high blood pressure, diabetes.
Other interventions include preparing isolation areas in hospitals, procuring additional equipment, and increasing testing capacity for the H1N1 virus. Additional supplies of Tamiflu used to treat H1N1 has also been acquired through the Health Ministry, while a new policy decision was taken to make the drug more widely available.
We wrote to the pharmaceutical importer. We asked them to bring in more to have it available in hospital pharmacies so that consultants would be able to prescribe this.
That decision was expanded to allow importation to private pharmacies.
Of course, you would need to have a prescription by a physician, and in the same breath, sending out the information to physicians around the country as to who we recommend should get Tamiflu. So we really don't want it to be everyone, or soon you'll have resistance being developed towards the product,
Public education has also been a big part of the ministry's response mechanism, with constant messages urging persons to observe proper hygiene practices and take other measures to prevent infection. These include cleaning hands frequently with soap and water, covering one's mouth and nose when sneezing or coughing, avoid touching your eyes, nose, or mouth with dirty hands, and avoid contact with persons with flu-like symptoms.
So we really want to ensure persons get more serious about protecting themselves.
After confirming Jamaica's first case of the Zika virus, a number which has subsequently gone up and is expected to increase further, the Ministry of Health has been busy trying to eradicate the vector. As the virus is spread by the bite of an Aedes aegypti mosquito, the major thrust of the intervention has involved destroying mosquito breeding sites around places where people live and gather.
And so we increased our fogging in these areas especially, in addition to the routine fogging being done in all areas within the country.
A national cleanup campaign dubbed Operation Mosquito Search and Destroy was launched in Portmore and Spanish Town and has already been to Ocho Rios, with Mandeville next on the agenda.
Because fogging only kills 30% of adult Aedes aegypti mosquitoes. So we needed to get out to the public that it is the breeding sites that we need to destroy to not have more adults coming. You can't depend on fogging alone. In other words, this is far more than a Ministry of Health issue. It's about you and your home, your environs.
The ministry is also receiving help from local stakeholders as well as the Pan American Health Organization, with one of the biggest results being the upgrading of the University of the West Indies Virology Lab. That lab, which is a national influenza center, means Jamaica is now equipped to conduct local tests for the Zika virus.
The waiting period to determine infection has been significantly reduced.
Public education is also a big part of the ministry's Zika virus response program.
So what is it that we're asking you to do? We want you to make this a habit. Once a week, search for and destroy the breeding sites of the Aedes aegypti mosquito.
For more information on the influenza A, H1N1 virus or Zika, contact the Ministry of Health or the nearest health center.